Okay, so Farah, can you explain on the healthcare aspect that you mentioned just now?
Okay, actually in this rise we are being more focusing on the healthcare, which is to achieving a universal access to a quality healthcare. For example, like enhancing targeted support, which is the 153 public hospitals, specialized medical institutions, and 2,863 health clinic established at end of 2017. And then another example, which is the 204 mobile clinics and 361 clinic in Malaysia, and the flying doctor services operated by 12 teams to deliver service in rural and remote areas as at end 2017. What we been more focusing on the healthcare because we want to improve the overall healthcare states and well-being of the rakyat. So for example, we know that the costing for the medical services is a high cost, so might be it tough for the people in the B40 people especially, right? Because previously we don't have the clinic on Malaysia, then now we have a clinic on Malaysia. So regarding to the clinic on Malaysia, it make a people easy access, so everyone can enjoy the benefit, because we need only pay RM1, then you can do a checkup, then you can get a medicine, so the people are not being burdened by the costing of the medical. Instead of previous that we don't have the clinic on Malaysia, the people need go to the other private clinic, so then the costing is a bit high, and then the people need to using a lot of money. Instead of that, in this healthcare also, it improving delivery system for better health outcomes. For example, the fees and medical order in 1982 revised a new fee structure introduced in 2017 for selected healthcare services. This is because it want to reduce the financial burden of the government while ensuring quality healthcare. What you can be explain more about the housing, since the previous I mentioned about in the second prize we are being focused on the housing, healthcare and crime prevention. So maybe you can explain more on what you really understand about the housing that will be explained on the second prize.
Yeah, sure. 30.9% of the 450,610 units were completed. Among the units completed under various initiatives. Okay, the first initiative, the state's government housing program, carries 32,862 units. And then the second one, Syarikat Perumahan Rakyat Berhad, carries 31,421 units. My first home scheme program and the first house deposit housing scheme benefited 2,598 and 1,474 buyers respectively. System Bank Data Perumahan Negara developed by National Housing Department enable data sharing among agencies and state government, and improve the coordination as well as implementation of public affordable housing programs in suitable locations, so it will be easier for the buyers to detect the location and to navigate the location. Now, for crime prevention, right? So what is the crime rate that's been operating in our country?
Okay, actually in this rise we also focusing on the crime prevention. For example, like creating a safer living environments for the living communities. For example, is enhancing crime prevention, like promoting a crime prevention awareness with all of the society, like children, women, and also all the people. So example is 7,478 awareness programs by Amanita, which is to provide a housewife with personal safety information on the crime prevention. So means that in this program, the people are more aware on what will happen around them, so they will know how to protect themselves instead of to know how to do an action if they are facing with a serious situation, right? So that is one of the important things that the people in the society need to know to prevent themselves.